going to be doing IV infusion, the starting of one today. So the first thing I'm going to do is I'm going to check my orders, and I'm going to make sure that I have an order for it. I have this thing here. I'm going to check the MD order, and I'm also going to check the MAR, and I'm going to make sure that they match. Looks like they do. So I'm going to go into my med room. I'm going to get all my stuff ready, my supplies. So I'm going to get some gloves. I'm going to get the solution that we're going to hang. I'm going to make sure that this isn't expired, it's not discolorated, it doesn't have any particles in it. When I get the solution that I need, I'm going to take a piece of tape here. I'm going to label on the tape my patient's name, date, the infusion that we're doing, the start time of it, and the time that it should be completed on here. Once I'm done with labeling that, I'm going to get my tubing here, make sure I have all my other stuff. Once I'm done with getting all this ready, I'm going to wash my hands. And I'm going to apply my gloves. Once I have my gloves on here, I'm going to open up my tubing. I'm going to get out my tubing. And the first thing I want to do is I want to unclamp this. I want to label my tubing. So the label here, let's write on it. We're going to put the date today, we're going to put the time on there, and I'm going to put my initials on here. When I'm done with that, I'm going to get it untangled here. Alright, I'm almost there. Start at this end. Alright, get that undone here. Alright, I'm going to take my clamp here and I'm going to clamp it up so that nothing comes out here. I'm going to undo my solution here. I'm going to open my spike here. Then I'm going to spike my bag. I'm going to turn this in here. And then I want to fill up my chamber till it's about half full. And then once that's about half full, I'm going to stick this up here. And I'm going to let this run and fill up the tubing. I'm going to watch it and make sure that there's no air bubbles in here. This all that gets all the way down. I'm going to close this off. Okay, and I got that ready to go. I'm going to take all of my supplies with me down to my patient's room. I'm going to take off my gloves, wash my hands. I'm going to go into my patient's room. I'm going to knock on the door. I'm going to introduce myself. I'm going to let them know that we're going to be doing IV insertion that the doctors ordered for them. I'm going to ask them for their name and date of birth, something to identify them. I'm going to make sure that they have on a snap gown. If they don't have one, I'm going to make sure they get one on. I'm going to make sure the bed is in the right position, the right height, just in case they need it a little higher or lower, whichever way. And then I need to make sure that the patient's in a good position and they're comfortable. So I'm going to first select an IV site, which I'm going to do on this patient's arm. So I'm going to use my tourniquet, and I'm going to place this on there. I'm going to kind of feel for the patient's veins here. Once I find my site and I make sure that they have a radial pulse, if they do not have a radial pulse, I'm going to release the tourniquet and I'm going to reapply it just a little bit less tight. And once I find my site, I'm actually going to undo this. I'm going to go wash my hands and put on my gloves. Once I put on my gloves and I'm ready to go, I'm going to hang this up in the patient's room first off. So I have it ready. Okay, and then I'm going to apply the tourniquet to the patient. I'm going to make sure that I place a pad under here so I don't make a huge mess everywhere if I accidentally get blood on their stuff. I'm going to get my needle, and I selected a 22 gauge needle, and I know this is appropriate for this patient. I made sure with their age and the site that I've picked, and I'm going to take my alcohol pad, start in the middle, and I'm going to kind of go in a circular motion all the way out and get rid of that. Once I've done that, I'm going to get my needle out here. Okay. I'm going to make sure that my bevel is up on this, and I'm going to kind of anchor this vein with my fingers down below. Let me clamp this one real quick. Okay, so I have this anchored, and I'm going to insert at a 35 to 45 degree angle, and then I'm going to advance the catheter once that's in, and I'm going to kind of hold that and pull back my needle. And then once I have that going, I'm going to close this just real quick. And I have my lure lock and my saline here. Get this together here. And I'm going to attach that onto there. And then I'm going to flush this. Make sure that that goes in, and it looks like that's going. I have it in there, so I'm just going to do a quick flush, undo that, and discard this. My needle, I'm going to put it in my sharps container. I'm going to take my extra alcohol pads, anything else that I have laying around. I'm going to clean this up and kind of just make sure I don't have a bunch of blood everywhere. And then I have a 2x2 I'm going to stick under here, so hopefully that'll help the patient's arm. It won't rub on it. And then I have this little Sure Sight thing, cover up. And on this, I'm going to put the patient's date, my date, my initials, and the gauge that I used on this. And then when I'm done, I'm going to cover this straight up with this. Kind of tape it down there so it doesn't move. And I want to watch that and make sure that everything's flowing good. And once everything's flowing on that, I get rid of all my trash, clean up everything. Release this off the patient here. Clean up my mess here. And I'm going to get my IV line here. And this is sterile because I still have my cap on it. But I'm going to wipe the end of this with my alcohol, remove my cap, and I'm going to attach this here. Once I have that attached, I'm going to make sure this is flowing. Make sure that all my clamps are undone here. Make sure that this is going at the proper rate. Looks like we got all that going. Everything on there is going good. Everything looks good here. I want to make sure to tape this up here. And I have an anchor tape on my lure lock, and then I also want to tape up here so that my IV line doesn't get pulled on. So I'm going to tape this, and I might tape it in a couple places, having that all taken care of there. So once I've taped this down, everything's going the way it should. I'm going to take off my gloves. I'm going to wash my hands. I'm going to talk to my patient. I'm going to lower their bed. I'm going to make sure they have a call light in place. Make sure they're in a comfortable position. Make sure everything with the IV site is going good. Make sure it's not infiltrated. Make sure that all of it's going where it should, and that there's no swelling or nothing else like that, and they're not having any pain with it or anything. Once that's all done, I'm going to step out of the room, and I'm going to make sure that I'm going to document. I'm going to make sure that I check on this IV. I'm going to come back, check on it, make sure that everything's flowing good. I'm going to make sure that, you know, the site isn't infiltrated, red, that I don't have any issues with that. And once I make sure that all that's done, I'm going to step out and do my documentation on that. Make sure the flow of the rate for every hour is good.